So this video demo is going to talk about the classic cerebellar tests, which are actually coordination tests of finger to nose, finger to finger, and heel to shin. So these tests are looking at the ability to coordinate multi-joint muscles and with or without visual feedback. So the cerebellum uses sensory feedback to control motor output and is responsible for coordinating multiple joints for a smooth trajectory of movement for accuracy. And so the finger to nose test is done with eyes open and with eyes closed. And as the evaluator, you're looking to see if there's a difference between the two. So you're looking for accuracy. So when you explain it to the patient, you tell them to start with their arms out to the side. You're going to have them touch the tip of their nose with the tip of their finger, alternating between their right and their left. And then you're going to ask your patient to do it with their eyes closed, looking to see if it's accurate or not. So that's finger to nose. And thank you, Ryan, that's good. So if there is an impairment with their eyes open, you're thinking that there is more of a motor deficit. You're looking to see if they miss their nose. You're looking to see if there's a little bit of a tremor at the end of trying to reach their nose. That's a motor output problem, and they're still using visual feedback to try to guide the motion. But if it's not accurate, it's probably the motor output piece. If they're good with their eyes open, but as soon as you ask them to close their eyes, they have trouble finding their nose, that suggests that there's a sensory ataxia, meaning that the proprioception that they should be able to use to connect their finger to their nose is impaired. So they're fine if they can use vision to help guide it in, and they're demonstrating that their motor control is good when they have visual feedback. But when you remove visual feedback, they start to kind of wander around a little bit and have trouble getting to their target accurately. That suggests a sensory ataxia, rather than the motor ataxia associated with a cerebellar lesion, which is about the motor output side, whether there's vision or not. Finger to finger is a similar test where you ask somebody to touch their own nose and then touch your finger in three-dimensional space back to their nose, and then you just keep going into different quadrants of their workspace. And this is a little bit more of a kind of a little bit more of a three-dimensional coordination test. So there's a visual challenge, a depth perception piece there, but also a little bit more challenging coordination task. It's not just an elbow hinge for accuracy. So this has to be done with the eyes open. You really can't do, finger to finger with the eyes closed, but you're looking at the accuracy of the trajectory. Does it wander around? Is there a little bit of a tremor? So do they stop short or do they go past the target? That's what dysmetria is. So you're looking to see if there's accuracy and efficiency in that reaching trajectory with that sort of test. The heel to shin test is just asking your patient to take the heel of one foot and slide it up the shin of the opposite leg. I find that test is very much limited by hip strength and hip range of motion. So sometimes this is done in supine if people have weakness. But again, it's supposed to be similar to the finger to nose test with the upper extremity, but a lower extremity coordination test.